Let me tell you why I don't recommend topical minoxidil or Rogaine, as it's more commonly known, to my patients, even though it's one of the only FDA-approved treatments available for hair loss. Let's go over a common clinical scenario. A 26-year-old man or woman comes into the office complaining of some hair loss. Maybe their hair is thinning or their hairline is receding, and they're diagnosed with androgenic alopecia, the most common form of hair loss. Topical minoxidil is then recommended to prevent their hair loss. But then 6 months or a year goes by and they're continuing to lose more hair. And they aren't sure what to do next because they're taking a medication for their hair loss. Let's go back in time to August of 1988, when the FDA approved topical minoxidil for treating men with baldness under the name Rogaine. It's interesting to note that the FDA actually rejected the initial submission under the name Rogaine because they thought it was misleading to the consumer. And in the original clinical trials, what was found is that patients who used topical minoxidil twice daily for 4 months had the following outcomes. Dense hair growth occurred in about 8% of patients and moderate growth in 31%. The remaining 61% of patients experienced little or no change. Now let me give you the reasons why I actually kind of hate topical minoxidil. It's not getting at the underlying mechanism of hair loss in most men and women, which relates to androgens. There was a study done in hamsters in 1987, and it was concluded that topical minoxidil does not act as an anti-androgen in the flank of the golden Syrian hamster, and that was later confirmed in human studies as well. Instead, it can help with converting some of our villus hairs or the finer hairs into more terminal hairs that are more robust, essentially improving the caliber and the length of hair, not really increasing the number of hairs, and also not preventing further hair loss. So the main problem is that people are starting this medication to prevent further hair loss, but they're noticing that more hair is falling out because there's nothing truly preventative about topical minoxidil. It's like hitting the mark but missing the bullseye. Instead, most people ought to be on an anti-androgenic agent to help with hair loss prevention, and that includes agents like finasteride or spironolactone. Because more importantly than thickening up some of the hairs that you have, it's essential to try to reduce further hair loss. Keep in mind that minoxidil is a stimulant for your hair, and topical minoxidil is a weak form of stimulation. Other ways to stimulate the growth of your hair include PRP or platelet-rich plasma, low-level laser light therapy, microneedling, and exosomes, and we've talked about each of these different methods on this channel previously. One way to think of minoxidil as a stimulant is to think about this type of analogy. Let's say you're feeling tired, right? What do most people do? They get a cup of coffee, right? And that acts as a stimulant to make us more awake and able to function better. But it's not necessarily getting to the underlying reason for your feeling tired. It's most likely because of a lack of sleep. So the right way to approach the problem is usually to get more sleep rather than just drink coffee. But in many cases, people do both. Anti-androgenic medications like finasteride or other DHT blocking agents are essentially the equivalent of sleep for your hair. They get to the root cause of hair loss for most people, no pun intended. Let's briefly go over how anti-androgens work. Normally, DHT goes on to affect DHT-sensitive hair follicles, leading to miniaturization, and that eventually leads to hair loss. DHT blockers block the conversion of testosterone to dihydrotestosterone, which is the more potent form of that hormone, limiting the effect on hair loss. Oral finasteride at a standard dose of 1 milligram a day is effective in about 90 to 95% of men. Some do need higher doses or the more potent cousin dutasteride to further prevent hair loss. And oral spironolactone is effective at the standard dose in about 50 to 70% of women. Other DHT blocking compounds that are more naturally occurring can be found in different products such as our shampoos, conditioners, or other styling products. These natural compounds can include saw palmetto, pumpkin seed oil, curcumin, and caffeine. I've made a video about this in the past, so if you're interested in these, make sure to check out that video. And we've designed our own hair thickening products with these key ingredients in mind, so to learn more, head to feelconfident.com. Another issue with topical minoxidil is its limited efficacy, especially compared to its oral form. In my practice, I see much better results with oral minoxidil compared to topical minoxidil for thickening up your hair. And we have a dedicated video on oral minoxidil on this channel. Let's go over a few recent studies on this topic. A recent study showed no statistically significant difference between topical and oral minoxidil, but this was likely because there were too few patients in this study, which was a total of 65 people. Another recent study on 52 female patients showed a slightly higher improvement in hair density with oral minoxidil, which was 12% versus 7% with topical minoxidil. But again, there was no statistically significant difference detected. Clinical research is hard, and it's hard to recruit tons of patients for these studies. So most of these studies have too few patients to really start to detect those statistically significant differences. So in my experience, instead of using 2% or 5% topical minoxidil, when you use 100% oral minoxidil, you tend to get better outcomes. If you're looking for prescription or non-prescription hair loss treatments, make sure to check out feelconfident.com. Topical minoxidil also can have some negative effects on your scalp. Specifically, it can cause a local irritation or an itchiness called pruritus on the scalp surface. This is usually because of an ingredient in the solution form of topical minoxidil called propylene glycol. While propylene glycol can improve the delivery of the drug, it also can cause this local irritation. And the foam version of topical minoxidil usually eliminates this issue because it's made without the propylene glycol. But topical minoxidil also leaves a greasy residue on your hair, and usually that requires you to wash your hair more frequently to try to get rid of some of that residue. Another reason why I'm not a major proponent of topical minoxidil is because of its twice daily application. So in addition to the residue that it can leave on your scalp, another reason why there's poor compliance with this medication is because it's supposed to be applied twice daily to the scalp in men, as opposed to oral minoxidil, which can just be used once a day. That encourages people to use minoxidil more regularly and more consistently to improve their hair. Yet another reason why I dislike topical minoxidil is because of its potential for animal toxicity. Minoxidil is highly toxic to dogs and cats, even from very low doses, even if it's like from a drop or a lick. Signs of poisoning in cats include anorexia, vomiting, lethargy, difficulty breathing, fluid in the lungs or the chest, or low blood pressure. And for dogs, signs include lethargy, vomiting, bounding pulses, increased heart rate, and low blood pressure. Signs usually occur within 45 minutes to a few hours. And some of the toxic exposure scenarios can include a pet licking his owner's skin or pillowcase, a pet being splashed during a medication spill, a pet searching through trash. And there was a study that actually summarized these different types of scenarios. And one study found that death occurred in 8 out of 62 cats, that's about 13%, that developed clinical signs. And I think in general, the exposure is going to be reduced if a person takes a pill rather than putting this topical stuff on their head and leaving some residue on the pillowcase or really anywhere else in the house. So the takeaway here is that minoxidil, especially in its topical form, is a mild stimulant for your hair, but it's not getting to the root cause of the hair loss, which is hair follicle miniaturization from the effects of androgens. Eventually, you'll lose the battle with hair loss if you're only using minoxidil as your hair loss treatment and you're not preventing it with anti-androgenic therapy.